From Rotary Magazine, this is the Rotary Voices podcast. I'm your host, Jerome McDonnell. In 1979, Rotarians backed a polio campaign in the Philippines and decided it wouldn't stop there. The global campaign to eradicate polio now stands as one of the largest, most successful public health efforts ever. More than 20 million cases of paralysis have been avoided. Rotary has some pretty great partners in the Global Polio Eradication Initiative. Including Rotary, the GPEI consists of the World Health Organization, UNICEF, the U.S. Centers for Disease Control, the Gates Foundation, and the Gavi Vaccine Alliance. Leadership from the World Health Organization and UNICEF are visiting Rotary International Headquarters, and it's a great opportunity to share them with you on the Rotary Voices podcast and check in on how we're doing on polio eradication. With me is Dr. Jamal Ahmed. He is Director of Polio Eradication with the World Health Organization. He serves as the Strategy Committee Chair for the Global Polio Eradication Initiative. He's from Kenya. Nice to meet you.
It's with you.
And with us from UNICEF is Stephen Lawai. He's director of the Polio Eradication Program with UNICEF. Stephen's originally from Belgium and previously served as UNICEF's head in Somalia and Madagascar and deputy head in Congo and Cote d'Ivoire. Great to meet you, Stephen. And with us from Rotary is Valerie Wafer. She is former Rotary International Director, and she is now with Rotary's International Polio Plus Committee. She lives in Toronto. Great to meet you, Valerie.
Nice to be here. Thank you.
I wanted to get you all to know you all a little better and what brought you to this work. It is work that I think everyone would see as, extremely purposeful and meaningful. How did you all gravitate to polio eradication? And Jamal, you want to start us out?
Yeah, no, thank you so much. First of all, it's wonderful to be here with Rotary and with the Rotary Voices. I think the work on polio was organically, I think I joined it in a very organic way, if I may say. I was a district medical officer of health in Kenya, in a very rural district, where one of my tasks used to be to implement the surveillance activities, campaigns, and many of the other activities. So on the ground, as Rotarians were fundraising globally and ensuring that children across the globe are vaccinated, I was effectively the tool on the ground that was helping to deliver. Over that, through many years of work and through many other activities, slowly I've shifted from working in my home country to international and global health and working in various countries on polio and polio-related activities.
Stephen, how did you come to this work? How did you come to polio eradication? It sounds like you've been around the block with emergency work in UNICEF.
Yeah, no, I started with emergency work, my career. And I was for a short period, about a year, I worked in polio in Somalia in the beginning of the 2000s. So it's nearly 25 years ago now. And that was really setting up this campaign in the middle of a country that was dominated at that moment by warlords. And we had to negotiate, etc., etc. And that was my first interaction with the polio world, how to do that in very difficult circumstances. And then I moved away from this polio world back into my humanitarian world where I traveled around this globe to set up responses to humanitarian situations in very difficult, high-risk areas. I was a little time in Gaza, for example, a long time ago, but also been in Cote d'Ivoire in a very turbulent period, the Democratic Republic of Congo, Somalia back, Madagascar. Madagascar was less of a threat area, but anyway, there were countries where you had to set up things in very complex situations. And that brought me back to polio. Then I got back into the polio work as director of polio eradication and at UNICEF. And it helps because in a way or another, the countries where we have these emergencies and conflicts going on are also the conflict where the virus found gaps in the health systems and where the virus found a way to propagate again. And if you look at the countries and particularly in those countries, the areas where we find virus, and you overlap that with a conflict map or fragility map, it's more or less the same. This kind of experience helps as well, guiding the teams in the field who work in those very difficult or complex settings.
Really interesting, Stephen. And Valerie, you're kind of new to the Polio Plus committee, but was director of international affairs at Rotary. How is it? It sounds like you're learning stuff all the time.
I am learning constantly, but I'm probably also a typical Rotarian who comes from a country, and I was born in 1965, so I'm sharing my age here, where, the endemic was over in Canada. People were being immunized. And it wasn't until I joined Rotary that I realized that polio was still around. Hearing from some of the members of my Rotary Club about the summers they couldn't go swimming in the swimming pool, they couldn't go to public places, go to summer camps. And so really the learning experience for me was pretty quick in Rotary. And then I had the opportunity to go to India for a National Immunization Day. And it was actually the year that the last case in India had occurred. And so just having that personal experience, being on, I tell this story so many times, being on that dusty street corner with all the noises going on as you hear in India, just brings back so much memories of, if India can eradicate this disease, anyone can do it. And the hope that that spread through Rotarians who had been fighting this fight for now over 40 years is a big boost. And so, I'm so thrilled to be learning every day, to have been in Geneva last month with our partners, UNICEF, WHO, to learn about the whole process of what they actually do on the ground and social mobilization and procurement and outbreak response. It's just incredible. And so, I feel like my story has changed now as well. And with World Polio Day coming up in October, I just feel like I have a new story to tell. And the accountability of the money that we raise in Rotary is in such great hands. It's making such a difference. And we will get there. We will get there. And I'm just so thankful to have these new friends in Stephen and Dr. Jamal, because we're in this together. And so we might work for different organizations, but we have a shared goal, and that goal is going to be realized. And so it's a wonderful experience. And yes, I'm learning every day. I really am.
I've seen it described that we're 99.9% of the way there to polio eradication, and it's just that last 1/10 of 1% that is bopping around a little bit here. Can you explain where we are exactly at, Dr. Jamal? We have not a whole lot to go, but it's in very tough places.
Absolutely. And if you step back and you imagine when, as you rightly said, in Manila, those years back when Rotary kickstarted this whole process, outside of maybe North America and a few countries, maybe in Europe, wild polio was endemic everywhere else, from almost all of South America, Brazil, big country, the whole of Africa. I don't think there was a single African country that was not endemic. Many European countries, by the way, many Asian countries, including big countries like India and Indonesia, and highly populous countries like Bangladesh. So that effort, with the virus now cornered in just two countries, the wild virus, just highlights the road covered and the distance covered. So when we say we're almost there, we forget how far we've come. And as Valerie was just highlighting, it was a big, mountain to in India. It wasn't easy. India is one of the most challenging areas for polio transmission when it comes to the underlying structures, the population density, how the whole situation. We call it an area with a high force of infection, technically. So Pakistan and Afghanistan now, the virus is the main challenging zones are actually in areas along the common border between Afghanistan and Pakistan. and they have peculiarities, insecurities, inaccessibility, other challenges, socioeconomic challenges. And overcoming that means ending wild polio for good. And just to highlight, when we talk about wild polio, we talk about three types: type 1, 2, and 3. Two of them we are done globally, including in Afghanistan and Pakistan with wild polio. And the third one is what we are fighting now to finish, wild polio 1. And if we do that, then it brings up the next stage of the eradication, which is to end what we call variant polioviruses that come from the tools we use to fight the disease. And and that will give a big wind in our sails, and hopefully push us to the end. When we say 99.9%, I will actually even think it's 99.99%. Going back to that first day in Manila.
And
I like that. I think we should start using that percentage.
and that is a great framework to think about it. And so that and what Stephen was saying earlier about instability, that is exactly what is going on along the border of Pakistan and Afghanistan. That is where it still gets to go. And one of the great benefits of a vaccine campaign is it builds up a healthcare initiative, a healthcare arm. If you didn't have one before, you've got to have one go in, and so we've essentially got to have some kind of healthcare presence in that community now.
Absolutely, absolutely. And what one thing this program has been very good at for many years is never to take an obstacle and say, "Oh, we can't do something about it." We roll our hands and give up. So in all of these areas, we just have to innovate, and by innovation, it doesn't mean just technical know-how. It just means thinking through how do we access those children in those villages that are inaccessible to us momentarily, and figure out how to reach that. And UNICEF has been a fantastic partner in many ways when it comes to this, in engaging with communities, working through community influencers and religious leaders, and and helping us cover that last mile into those pockets that are extremely difficult to reach. And these, Afghanistan and Pakistan have been the epicenter for so many things in the last 2 decades. So there's a reason why it's Afghanistan and Pakistan. It's not for many reasons beyond just the public health.
There's 6 partners in the Global Polio Eradication Initiative, and UNICEF is one. Can you explain a little more about UNICEF's role and what it brings to the table?
Yeah, well, Jamal already said it.
Yep.
Well, we do two things, and it's very simple. There's the first one, when you set up this, when you're eradicating a disease that's vaccine preventable, you need a vaccine. Otherwise, you can't eradicate. And once you have the vaccine, the children, their parents have to accept that the vaccine is given to their children. So you have to convince them in a way or not, or they have to know about it. And those are the two things we do. First of all, we buy all the vaccines for the Global Polio Eradication Initiative and bring them to the countries and to the children and to the vaccinators that will vaccinate with these vaccines. And then that's a major job, because we're not talking about one vaccine. We're talking at this moment about 3 vaccines that we procure. And these vaccines have to be bought about 6 months to a year in advance, because they're a production process. So we have to do a lot of planning, but also see that they reach in these areas that are quite difficult, and where you sometimes don't have health systems working. And where we have to see that there is a cold chain. It means these vaccines have to stay on a certain temperature till the end. And we have to see that whole cold chain is not interrupted. And that sounds easier than done, because that means from the factory up to the vaccination point, you have to keep that vaccine on the same temperature. In the plane, in the boat, when it arrives in the capital, when it goes to the provincial capital, and then it goes to an area in a health center, or sometimes not a health center, on the back of a donkey, or a vaccine carrier that somebody has to carry for 10 miles. the temperature has to be maintained. So there's a whole organization behind that. That you also do that in places where sometimes there are no health centers. And then we have to work with big cool boxes and bring them from sometimes 100 kilometers further to that vaccination point. Then again, have some eyes in smaller cool boxes and keep that at the same temperature. But for that, you have to have fridges, freezers, etc., etc. Everything has to be in place. So it's an enormous work and enormous planning, the buying and the sending of the vaccines. And then the second thing we do is we have to convince people that these vaccines work, that they don't have to be afraid, and go against all kind of conspiracy theories. Luckily, there is trust in these vaccines because we have been doing this for the last 40 years. People are used to polio vaccine, and they know that there's no negative effect. But nevertheless, people have to be aware that the campaign is going on, and that is not automatic in the middle of southern Afghanistan. So we have to talk to these communities. We have to explain it. We use all means. Can be social medias, for example, but can also be TV and radio that we use. But also people that go into the streets and shout through the streets that a campaign is coming, and they have to get out of their houses or let their doors open for a vaccinator. All means that are possible. But then we also have to go into a personal conversation to talk to the mothers when we are vaccinating, what we're doing exactly, and what side effects could there be, if there are any sound effects, but also when the next round is, and how long their children will be protected, etc., etc. And if there is a mother or father that refuses, trying to convince this mother and his father, and then if they're not convinced, next time come back and try to convince them again. And with doing that, we actually convince 98% in most of the cases to get vaccinated. But that needs trust. So you also have to select the right people to talk to the communities who are part of those communities. It's quite an immense job to do that, taking into account all the different places and cultures where we're working.
Um, that's really interesting. That's really on the ground stuff. The whole initiative, the Global Polio Eradication Initiative, though, has it's a unique public-private partnership. And Valerie, you've been seeing that in Geneva. The wheels kind of were on that. Explain how the private funders come in, and the Gates Foundation's obviously one of them, and certainly Rotary. It all meshes together at
Well,
once.
you're absolutely right about how it meshes together because as Dr. Jamal and Stephen has explained their role from their organizations, you can see how intricate it is and how we can't be responsible for everything as one organization, right? And we can't do it ourselves. And that's why our partnership is so important. You know, we as Rotarians certainly are committed to fundraising. We have made a $1 billion investment in this over the years, and it is an investment. It's not something we can walk away from because the consequences of walking away from it or not fulfilling our promise is just too hard to imagine. We just can't do that. So we are committed to raising $50 million a year. And I'm so proud of the Rotarians around the world and all the innovative ways that we look at fundraising, because that money is important for that match from the Gates Foundation. And so, of course, the Gates Foundation matches us 2-1. We hear a lot about, the fatigue. We've been at this for a long time, and Rotarians have been part of this for over 40 years. So we hear about donor fatigue. We hear about, what's next for Rotary. But nothing is next until we finish the job that we have in front of us, which now I'm going to say is 99.99%. Thank you, Dr. Jamal. And, I think that we have been doing a really great job. Last year alone in the Rotary world, we saw more clubs giving to polio. we saw more gifts, major gifts to polio. Our Rotarians are realizing that we need this final push to get the job done, and they're stepping up to do it. One of the mechanisms that many districts around the world right now are using is the Polio Plus Society. So if you pledge an amount every single year at a recurring donation, you can belong to this Polio Plus Society. And I have to say, Rotarians love their pins and they love to be part of something, innovative and know that they're making a difference. So we have to continuously be innovative to fundraise and to get where we are. But the one thing that I think is no surprise is that in the areas that we still have cases, we do not have a lot of Rotary clubs. Rotarians are the best advocates in the world for this. We have, 1.2 million Rotarians around the world, and each one of us have connections that we may or may not even realize today. Connections with local, national government officials, people who can make a difference, who can then use their voices. I happen to sit on the Canadian Advocacy Task Force, and we meet with our government on a bipartisan basis. Even when we're not asking for money, although I'm really proud of Canada and our commitment to always support polio and the GPEI. But we have these advocacy groups around the world, and they are truly making a difference, and the voices that connect everyone so that this does remain on everybody's agenda. And I know that times are really tough now and a lot of budget agendas for our governments around the world, but that just means that we have to work a little harder and we have to have these conversations more and more. We have to tell our personal stories, and we've all had, both of you have been in the field and you've seen and have so many stories. In Rotary, we know that personal storytelling, this Rotary Voices podcast is so important, because what happens is our audience is listening and they're going to be inspired for World Polio Day or to tell their own personal stories throughout the year of their experience, either of someone that they knew when they were growing up that had polio and why this is so important. So the effects of polio are still with us. And until this disease is eradicated, we need to continue this work. So it's definitely a partnership. We can't do our individual pieces as one. We need to work together.
I want to talk about some of the funding challenges because governments around the world have cut back on their public health budgets, and it's hitting everybody in the partnership. Almost everybody is seeing cutbacks. Some of them pretty stiff. Uh, I know that's a lot of what you're talking about these days. How do we juggle things around with these cutbacks? What are the how how threatening is this to the whole initiative of polio eradication?
There are so many committed countries and many member states of the United Nations, and who are really, really maintaining their support and continuing to support not just polio eradication, but also general global health initiatives. One thing that is clear is it's 2025, and an infection anywhere, an outbreak, is something that's a threat to everybody. There's nobody who is sitting in an island somewhere with no connection to the rest of the world. That may have been possible centuries ago. I don't think even it was ever possible, but not in the modern world. So with the funding cuts and the general funding reduction that we are seeing is a threat to the global health security in many ways when I look at it from that perspective. For polio, what it means is if, and currently we are lucky, thank God, we have a strong partnership that's pulling together and making sure that we are still on track to deliver our key objectives and our key goals. But for polio and even for other activities, it just basically means the risk of failure if the funding dries up is a resurgence in cases, a resurgence in children getting paralyzed, a resurgence in measles, a resurgence in every other childhood disease that we thought disappeared. And there's no way you will contain that in Pakistan and Afghanistan. It's going to spread out back to other countries. And we don't want that. That is something that we absolutely don't want. And the world, I think there are many countries and many member states who are pulling together to ensure that we remain on track for as much as we can.
Leadership matters, though, doesn't it? If I know that Nelson Mandela in Africa stood up and said we're going to eradicate polio in Africa, and he put his prestige behind an effort to eradicate polio when it didn't look really like a sure shot in Africa. It was all over the place. It that's that, but that's what it takes. And
Leadership definitely matters, and even in this country, in the United, it took the leadership of governments to deliver the vaccines in so many ways. We talked about the people, but also the research efforts. A lot of the work that was done was through that. Nelson Mandela was a hero. I remember in many ways the kick polio out of Africa effort that was linked also to major sports events that pushed that whole eradication effort. But also we have to remember the resources that was raised by this public-private partnership by Rotarians up and down the world who contributed their dollars and cents and made that whole effort possible. So leadership matters, but also that strong bond that this partnership has been having for many years is also as critical, I would think.
And I know that in a lot of communities, there is skepticism about vaccines. And Stephen, you've been dealing with this at UNICEF. And you mentioned you managed to overcome it in 98% of the time. How is that working? Are there new wrinkles in that battle to overcome skepticism about vaccines?
Yeah, they are, because we are in a connected world. It's a village we live in. So if there's someone setting something on the internet, posting something on the internet in Wisconsin, it might be picked up in Guinea Conakry and create a whole mayhem there. So we have to be aware what is going on globally, and particularly in social media, and we're monitoring that on a daily basis. Or actually, every minute we're monitoring it, and seeing if some of these rumors are getting out of control, and how we can counter it. We have about thousands and thousands of volunteers who are working now with us across the world, who countering these messages as well, and helping us tell what polio eradication really is about, and how vaccines can not only prevent you getting disease, but kicking the disease not only out of Africa, but kicking it out of the world, which is an amazing thing that humankind can do. But we also don't have to forget in terms of communicating and talking to people. It's not only social media. It's sometimes that very personal interaction that is necessary in far-flung places in the middle of nowhere, where people don't have access to the internet, and where you have to sit down on a carpet, have a couple of glasses of green tea with a lot of sugar, and be very patient and explain to a mother who is worried about her kids why again they have to get this vaccine, and why they don't get other public health interventions to them, and why it is necessary to vaccinate her kid against polio. And that takes time, that takes effort, that takes energy, that these mobilizers are bringing every day, that these community health workers are doing every day. And that is the key to polio eradication, is this motivation, this commitment of everybody who works towards this, from the director at WHO, Rotary volunteers who bring the money and talk to people about it and advocate with governments, to this a volunteer or community health worker at the bottom who's going to bring the vaccine, but also convince the mother to make it happen. It's a work of hundreds and thousands of people every day to make that happen.
and each one equally as important as the other, especially, Stephen, when you talk about the healthcare worker going door to door and not always in safe conditions.
Exactly.
And we really need to recognize the women
Yeah.
who put their lives on the line quite often to save lives.
Yes.
Right?
Yeah. And without the women, we can't do it. It's very clear. You see the difference between Eastern Afghanistan and Southern Afghanistan. In Eastern Afghanistan, the workforce is made of 50% women, and we got an exception for them to work there. In Southern Afghanistan, it's like 4%, and the difference in quality of vaccination is enormous. And where can the virus still survive? Where very few women are working, because we don't have access to the families, and we don't have the same conversation going on. It's really the success factor, and we don't see that. These community health workers, they're mainly women. It's remarkable.
I was really fascinated with the discussion today at our meeting about grandmothers.
Yeah.
And the role of grandmothers, right? Trusted matriarchs of the family. And yeah, absolutely.
Yeah, then these areas where we can't work with frontline workers that are female, we're using our grandmothers to also help us convince families, because they're trusted and their opinion is trusted.
And just to add, the same mechanisms that help us deliver the vaccines, the same community health workers also help report cases. In the event that you have something in a very insecure area, they figure out how to communicate, and we're then able to collect samples, test, confirm that there's some transmission going on somewhere. And so the whole system is alive. It's wonderful.
And also beyond polio. So, for example, the first Mpox cases in Africa were notified by polio workers.
Ebola.
The first Ebola cases, yeah.
The response in Nigeria to Ebola, a few years back, we had this massive outbreak in West Africa, and then there was a community, there was some kind of, movement to Nigeria, and they had a detection. The system that was triggered to respond to that initial detection and response and make sure that in a city like Lagos, in a country like Nigeria, you don't get Ebola out of hand. That is the whole network infrastructure established by polio.
I think that's probably an underestimated feature of the polio eradication effort, is that it had an add-on effect with so many other situations, and from infectious disease to just probably general healthcare extensions. It has just built up healthcare networks.
Absolutely. And, the beauty of this thing is it's using a single virus and a single disease and pushing the whole system forward. So it's raising the whole infrastructure down, up, especially, and this is where we keep on talking about equity in various forums. By definition, the eradication efforts is that you are trying to make sure every child, even in those most inaccessible areas, is reached. And when you establish those mechanisms, those same mechanisms then are used for every other public health intervention, whether it's malaria nets distribution, whether it is deworming and they give him, fighting some of those, the diseases that are linked to that, and even the vaccination programs for delivering measles. This whole system is based on that, and the detection and early response to diseases in the most difficult areas is again supported through this infrastructure.
We've touched on a few of the obstacles that are out there for eradicating polio, but are there some really promising developments out there that people should know about? Are there promising stories that are circulating right now and people should recognize?
First of all, since about a year, we haven't seen any cases anymore in Southeastern Africa, and there were hundreds of cases before. And then the countries like Madagascar, Mozambique, Tanzania, the Democratic Republic of Congo, that was the centerpiece of a big outbreak. There's nearly no cases anymore detected. So we are clearing large parts of the world where we had seen a lot of cases. That's a big success. And even bringing it a bit closer, we showed that we have the least percentage of refusals ever in Pakistan last year, ever. People who refuse the vaccine. That we have other issues still, but that is quite some data we have there. Um, and we rolled out a new vaccine in a period of 2-3 years that vaccinated, protected about 1 billion children, which is about, but not children actually, 1 billion doses were administered in a very short period of time of that vaccine. I could protect quite a lot of children against type 2 variant.
Absolutely. And just to add also, that Stephen talked about, these outbreaks. We had one in Southeast Africa. We had a wild polio virus that was exported, and we had that. Historically, such an outbreak will be multi-country outbreaks going to one country, another. We were able to contain it within effectively a few provinces, stop that potential spread, and close that outbreak. That's a big deal. Sometimes in public health, it's only the big events that make the news. You don't hear the news of those fires and embers that you put off very quickly and very rapidly. That was one big one. The other one is also through the investment of surveillance, through the polio program. We've been expanding the lab network in many countries. They now have capacities for sequencing, capacities for early detection. By the way, some of these capacities were used in the initial response to COVID. In Pakistan, for example, those initial detections was done by the polio lab through polio assets, because the tools that you use for one pathogen, one virus, can be adapted to another one if you just have the right primers and the right reagents. So the work that is being done, the technical know-how, that has been fantastic. We've been working also through the WHO also with rolling out new techniques in detection called direct detection, where you take samples and you quickly detect. So all of these are cumulative. They work on polio, but they also transfer technical know-how that can be used beyond polio in many countries.
Stephen, I understand there's something called infodemics that you've been working on at UNICEF, and this is a social media issue. And explain what's going on and what this is.
So it's a bit a watch about what is going on with vaccines on social media. So we follow all social media everywhere in the world, chat boxes, Facebook, what goes on X and other social media platforms, to in a way see what information are people spreading about vaccines. And there's a lot of good information. The majority of the information that people are spreading is really very positive, but there's also some very um, negative information and false information about vaccines. We don't not only track everything about polio, but vaccines in general, because it gives us an indication of the willingness for mothers to get their children vaccinated. And we see that sometimes rumors picked up in one part of the world come out of another part of the world and start creating havoc. So we know who these people are, where this comes from, but then we have also in each country around the world thousands of volunteers who are working with us to help us, and some of them are from Rotary. Actually, quite a number of them are in the different countries from Rotary. Help us then counter this information that is spreading, but also going into a dialogue with people who are spreading this information. Because everybody can have his opinions, but it's a question of talking to each other and stopping this kind of infodemics, as we call it, across the world.
So you've kind of got influencers out there on TikTok. Is that what you're saying?
Everywhere, not only on TikTok, they're on Facebook. I'm a bit the older generation, but yeah, on all the platforms that are out there, we have people, young people, older people, Rotarians, very young people. Some of them are teenagers that help us with it.
Now, I understand there's a new action plan that is with the WHO on polio. Can you explain what's going on with the action plan?
So no, thank you so much. Again, the action plan is a GPEI action plan. It's a collective action plan for the whole Global Polio Eradication Initiative. It is essentially we, as GPEI, took a step back with everything that's going on now in the world, with all the headwinds when it comes to funding and resource mobilization, and also understanding the current programmatic challenges that we talked about, for example, in Afghanistan and Pakistan, but also other parts of the world. We took a step back and we decided, okay, let's review the whole program and think through what it will take to take us to put us back on track on the road to zero, both in Afghanistan and Pakistan and globally. And that action plan is effectively a distillation of that work into one document, and we've completed that now. The Polio Oversight Board of the GPI has endorsed it, and our work now is to really get back and implement that. The essence of it is, number one, to realign the whole program and make sure that we are able to function within the resource-constrained environment that we are dealing with now, and we foresee that that environment may continue for a few more years. The second component of that is to really hone in on some of those subnational areas, not at the country level, but below the country, at those provinces and regions and districts where we've seen some persistent transmission for a while, identify each of those areas, the specific problems, and try to tackle those problems as quickly as we can, and redirect some of our resources through special initiatives to those areas. So hopefully through that action plan, we get more streamlined over the next few years, and we are able to push ahead and deliver that zero polio that we all want.
And Valerie, is there anything you want Rotarians listening to know about how they can help get to that place?
Well, just continue to tell your story, continue to advocate, to continue to support. There's a huge sense of pride that we're all going to have to know that we were part of this journey and that we made a difference. And I think that they need to take that ownership. They need to realize that they will be part of history. They are making history, and that, this is something that hopefully my grandchildren and their grandchildren all say, what is polio? Not the reason we say it today, because I know it happens today as well, but because it is no longer with us. And I think that once that happens, along with our partners, we're going to have a huge sense of pride, and that, second disease in the world that has been eradicated. And we were part of that.
Absolutely.
Well, go get them. Valerie Wafer is Rotary International's Polio Plus committee member, and also with us has been UNICEF's Stephen Laouare. He's the director of the Polio Eradication Program with UNICEF, and Dr. Jamal Ahmed is director of Polio Eradication with the World Health Organization. Go get them.
Good.
Thank you.
We will.